Today I'm going to talk about 5 things you must know before considering LASIK surgery. An honest guide from a LASIK surgeon for anyone thinking about it or performing it. Let's start with the truth behind the hype. LASIK is one of the most common and most life-changing eye surgeries in the world. But what if I told you there is a lot you don't always hear before you say yes? And today I want to walk you through the parts of LASIK that don't always make it into ads, consults, or glossy before and afters. Whether you're a patient considering it or young doctor learning the ropes, this video is for you. First, it's not just about 2020. We often focus on 2020 vision as the main goal. And while that's a great outcome, it's not the whole picture. LASIK reshapes the cornea, and although most people see very well afterwards, some may notice glare, halos, or reduced contrast at night. It doesn't happen to everyone and most adapt easily, but if you drive at night often or work in low light, it's something worth discussing in advance. A message for doctors: it's easy to overpromise, but visual quality is just as important as visual quantity. That's why consider all points in the preoperative examination and inform the patient about possible risks. Second, LASIK is not for every eye, and that's exactly how it should be. If someone has thin corneas, irregular topography, or significant dry eye, it may be safer to recommend an alternative. Saying no isn't failure, it's good medical judgment. The best outcomes come from selecting the right candidates. Third, dry eyes are real but treatable. It's normal to experience some dryness after LASIK, especially in the first few months. While it's usually temporary, it can be frustrating if you're not prepared for it, especially if you already deal with dryness before the surgery. We now have excellent tools to screen, prevent, and treat it, from specialized eye drops to in-office therapies. For surgeons, always screen the tear film carefully. It makes a big difference long-term. Tear breakup time, shimmer test, MGD size, don't skip the basics. Fourth, LASIK is a surgery, not a spa day. LASIK is quick and generally painless, but it's still surgery. You are awake, you'll feel some pressure, hear clicks, and there might be a brief smell during the surgery. It's normal. It's not very uncomfortable for most, but it's not a massage table either. I've had patients saying surprisingly, that was really uncomfortable, and internally I was thinking, well, yes, this is still surgery. What makes the biggest difference is the team's energy. A calm surgeon and clear communication go a long way. Personally, I talk my patients through every step. It keeps them relaxed and keeps me focused too. 5. Touch-ups happen, and that's okay. LASIK is highly accurate, but your eyes isn't static. After surgery, the cornea naturally goes through a healing and remodeling process. This healing can subtly change the shape of the cornea, which in turn may shift the final diopters, especially in high-end prescriptions. It's not a complication, it's biology. And when it happens, a small enhancement can fine-tune the result. Final thoughts: I'm a corneal refractive surgeon myself, and I love performing this procedure because LASIK is truly remarkable when it's done for the right reasons, on the right eyes, and with the right expectations. It's not about promising perfection, it's about delivering clarity, safety, and long-term satisfaction for your patients, because that's what truly matters.